David, some great announcement that just came out 2 days ago on the fact that Trent Hills is now going to see a COVID-19 assessment center. This one's going to be a little different, where it's going to be a mobile assessment center where it can travel around to Hastings, Warkworth, and Campbellford. Talk about why the need was there and how you were able to help the health team put this together.
The assessment piece in Ontario is something that we've long, as a government and as a community, we've been talking about. Obviously, with the Ontario's action plan, we committed an additional $3.3 billion to the healthcare system. And a commitment was made by the Premier and our government to expand the number of assessment centres across the province. In rural Ontario, the need to be able to move around has never been more poignant, and for this to be able to roll out not a fixed site like we have in Cobourg, but a site that's mobile and can move throughout the rural areas of our riding. I mean, we know that we live in a big riding that's larger than Belgium, and Northumberland County itself is quite large. So to be able to offer that is reflective of the rural nature of our riding, the needs of members of our community, and puts us in a good position with the few cases we do have now, but puts us in a good position to assess, and I think it wouldn't have been possible if not without the amazing collaborative spirit, which you're well familiar with in our riding, the leadership of the Trent Hills Family Health Team, the support of Campbellford Memorial Hospital, and of course our paramedics at Northumberland County.
When did they approach you about possibly getting this?
Well, it was the nurse practitioner lead, Samantha Dalby, who reached out to our office. Trent Hills Family Health Team had remarkable capability to do this and was looking at a partnership with the county on that. And so I knew that an assessment center was in the works here, and there was a possibility. It was a question about getting resources, working with our partners at MOH, to ensure that ministry was identifying the need out here, and we have one. So from my perspective, it was a no-brainer to help push for this, and to help ensure that from our perspective, the fiscal framework and the funding was able to flow in an immediate manner, because they were ready. I mean, it's nice often, getting the logistics, that's where the time comes in. But in this case, it was getting those dollars down, because they were so ready, and the remarkable collaboration, and the team was in a great position.
What's it going to mean for that area, excuse me, of your riding, where they're kind of in that area where they're half hour to Peterborough, or 40 minutes to Peterborough, 40 minutes to Belleville, 40 minutes to Cobourg, where people would have to travel to be able to go to an assessment center?
Yeah, well, I've long heard from the rural areas of our riding about ensuring that not only that they have a voice in the public policy making process, but that their needs are looked after. And though the long drive into Peterborough and down to the 401 was certainly a factor that went into the decision making to allocate resources into the rural area. But we also have an aging population. I know there were a lot of people out in the rural areas of Trent Hills that wondered, with the return of a lot of snowbirds, what effect that would have. So for us to be in a position where we're ahead of the game, where we're able to test, because we know part of the biggest challenge of COVID-19 to date has been the testing ability across. We're hearing that certainly in the United States, Canada's in a better position, but getting those tests up to date is the key to give us an accurate and a live glimpse of where we're at with the spread of COVID-19. And I think being in a position to get ahead of that in Trent Hills is responsible, and help ensures the safety, well-being, and accurate information for the residents of our rural areas of our riding.
You say it's excuse me. You say it's a work of both the Trent Hills Family Health Team and Northumberland Paramedics. What's the paramedics' role in this side of this?
So the paramedics are going to help with the mobile aspect of this. They, as you know, recently we've supported with the expansion of community paramedicine, and they're well trained and well able to be a partner in getting out. And part of the role of community paramedicine and why this is such a good fit, as we spoke about when we announced community paramedicine, but was they able to perform procedures in a non-emergency like setting. We now have the resources with additional frontline workers for community paramedicine to be able to go and respond to public health needs like this. So I'm a big fan of the chief there and of the work that Chief Detler's doing, and of course the organization and the capacity of Trent Hills Family Health to respond.
Sticking out within Trent Hills and with Campbellford Memorial Hospital specifically, they've put the call out that they're looking for medical supplies. What can you say to the residents that are in that area that they will be safe and that supplies will get to them? I know recently the announcement was made to make sure that a large purchase was made for all this equipment. What can you say to the people out there and to help them?
Well, I would say that there's no questioning that there are supplies issues across the world. Where when we originally at the outset here from a national perspective, I know Canada responded to the need in China with personal protective devices. And of course, this being a global pandemic, the global need is there. There are, from a logistics standpoint and a legislative framework standpoint, what we've done as a government is pass legislation, as you know, municipally with the Municipal Act to ensure supply chains continue to move and move fast. We've also created Ontario Together, a portal where we can see the manufacturing capability, and there's a real one-stop funnel. And it's funny, I listened to CBC Radio this morning, and they were talking about doing that in the United States. I mean, we're weeks ahead of that. Just provincially in Ontario. So we've positioned ourselves to be able to respond. I'm not doubting that there are certainly supply needs there. We're working around the clock to ensure that Ontario gets the required need from PPEs. We've issued a directive to ensure that they're being used appropriately in emergency-like settings. I know a lot of people have very valid concerns about this, but this needs to be guided by science, and it needs to be guided by the proper directives of our doctors and scientists and healthcare professionals to ensure that our allied health professionals, nurse practitioners, doctors, frontline workers have the supplies that they need. So we're working around the clock to help ensure that. In addition, I'd add that the ministry issued a recent directive. Hospitals are reporting daily now on their needs, which is something new this week. And so we're really getting an adequate look. And the hospital, of course, as a local member too, I'm also working to help triage some local capabilities and additional contacts we have to help do that. I mean, we're doing everything we can as a government. We've issued directives to all of the other sectors. A good example, I'm parliamentary assistant colleges and universities. A ministerial directive went down to all our universities, not only to do an asset management of what supplies you have and get rid of them into the sector to ensure that our healthcare professionals have what they need. But our universities are also responding and using innovation and helping address the shortages by developing PPEs themselves. So that's the sort of thing we're doing as a government to make sure we can meet the need. But there's no question there's global supply shortages, and Canada is working around the clock. Ontario is working around the clock to make sure we're in a position where we have the need, and we're asking the Prime Minister and the federal government to please support us, of course, in this, and we're working hard to ensure that the feds allocate the required amounts to Ontario.
You brought up the Ontario Together Fund, which was announced yesterday on Wednesday, a $50 million fund to help companies rework their current manufacturing to be able to start producing these equipment that is of need. Do you know of any areas or any businesses in this area that have reached out to you looking for some help or can offer help?
Yeah, we have. I mean, we've seen the high-profile case of hand sanitizers being developed by Brian and Coburg, and I've heard of a few others. From with respect to the largest need right now, I would say, which is on the mask side of things. I, you know, I'm we've put out on Ontario Together. I've certainly put that out through my channels. We're about to launch a toolkit here at its office. Haven't seen, to my knowledge, the mask sort of production or a pivoting of the original intent of the manufacturing lines for the purpose of N95s or masks. So it's something I'm looking for, and we're certainly reaching out. I know in Clarington, outside of our of Northumberland County, but there are companies pivoting to do that, and certainly I'm looking within Northumberland for solutions, and into the north in Peterborough as well.
Sticking with the healthcare field one more time, talk about the work and the admiration that not only you but all people across this province and country that have for the healthcare workers that are going in there, literally putting their life on the line every day, knowing that any day that they leave that hospital, they could be testing positive for COVID-19.
Yeah, I know that my message to them is thank you. This is an exceptionally trying time, there's no doubt, for our frontline healthcare workers. They're doing remarkable work, and I think what we can do to truly show our gratitude for the community is to allow them to do their work. Please do, what community members can do, which is to stay at home, practice social distancing. I was down at the beach a few days ago before the closure, and sort of walking along, and I saw a lot of people there when I was on the side streets. And I think we can and must continue to always do a better job at maintaining that social distancing, staying home if to the greatest extent that you can, with the exception of going out to walk your four-legged friends, and to do the essentials. But we really the next are going to be critical to flatten the curve. And the best way we can show our thanks right now to the men and women and on the front lines of our healthcare system is to do that. But for them, I'm at a loss for words and what they're doing. Hearing the stories on the radio, getting some messages from, I got a message yesterday from a local nurse and what she was doing. I spoke to a doctor yesterday as well, and I've heard from cleaning staff in the hospitals too, often unsung heroes, unmentioned as well. But my message is one of thanks. I know that they've worked around the clock to clear the hospital, to make sure it's ready. Up in Campbellford, I heard that they really worked at ensuring that they had free beds and have done remarkable work up there. So they're working exceptionally hard and are ensuring that our system is able to meet an increase in need should this happen. And we're all expecting this certainly, to get worse over the coming weeks. I'll be frank with people of this community, and as we've heard from the feds. But from what we can do to show our profound thanks to them is to stay at home and practice social distancing.
We're hearing the stories now that we're almost to the peak level where the numbers are continuously on the rise. Is there a possibility of more measures being in place by the government of what is essential and not essential?
Yes, absolutely. In fact, I know the Premier is reviewing this list right now as we speak. We're willing and able and fully committed to mobilizing all resources available, as you saw with the action plan, an unprecedented amount allocated to our healthcare system, and a reserve, the largest in Ontario's history. But we're ready to respond, and at the command table and with the expert guidance of our public health officials, we're ready to make any and all investments needed to help protect the health and safety of Ontarians. When it comes to ensuring the balance between the supply chains are open, that things are, we're getting food on the shelves for people. That's what people elect us to do. It's to make those challenging decisions that and we lean on expert advice of our public health officials. whom to date have given us excellent advice. We've seen them across Canada giving excellent advice. We'll continue to follow that, and we'll continue to work and respond to what we're hearing from the public as well. And the public have been remarkable too in communicating with my office on areas of challenge, the RVs and other things like that. I mean, as much as uh, I too am here in my boardroom, and between home and here, that's it. And our office, my staff are working remotely, with the exception of my right hand here, and we're working around the clock. But we rely on the community members to point out things like that. And so, we're ready to mobilize any resources necessary. And this has been a remarkable example of communities coming together, from the mayors to our county to the federal government as well. It's been a close working relationship I've had with our MP and everybody on this.
What have you learned about, maybe, that you didn't know about this community during this crisis thus far?
Well, I think, I knew certainly in our healthcare system, when we were one of the first areas selected for Ontario Health Team, of the remarkable collaborative spirit in our community. But seeing the Caremongers local Facebook group that now has thousands of members, to hearing stories of local business owners who are, while at home now, or their business may be shut down, dropping off X number of meals a day to people in need or to their employees. Every day there is a new story that almost brings tears to your eyes. So it's incredible to see the community's response. And I always knew we lived in a special community, but if there was ever any doubt with anyone watching out there that we live in a truly remarkable and special community, a rural community, a community where you say hello to people on the streets, where you know your neighbors and your local downtown shop owners, that's what's special about our community, and that's what's special about the response we've seen. Be it last night's a remarkable display at the hospital. We live in a special community, and I'd like to thank everybody for being a part of that, and for offering a kind gesture to others during these difficult times.